All right, welcome to our last lesson here. This is lesson 4 of module 4, and this is working with scribes. The title here is Scribes Need Direction because you are actually working with typists. And here's what we'll cover through this module and through this lesson: setting expectations and direction for scribes. And second is providing written directions for scribes, as opposed to having them sort of guess what we're trying to go for. So, setting expectations and directions for scribes. Scribes work best with guidance. A key factor to remember is scribes are typists. They are not clinicians. It is very difficult for them to interpret the myriad of complex language that we are throwing their way. And in addition, it is difficult for them to mentally organize how we have mentally organized our medical charting. It is hard for them to keep in mind what is important for an HPI versus what is important for a MDM or a physical exam. These are things that we have learned through the years that seem intuitive to us now, but may not be intuitive to them. So a key to working with scribes, because many people do say that working with scribes can sometimes be more work, but I'm here to tell you it can be extremely efficient if you give them the right system to utilize for you. And the key is providing them direction on the following. You want to provide them direction on standardization. And what do I mean by that? Very simple. This is actually just a translating everything we have learned in this note writing system onto your scribes. So for our HPI, we want to let them know for an HPI, we have a course, a character, an onset, a duration, and we want to give them our .hpi macro if we need to, and let them know that they can fill that out based on the patient's complaints. And then they can follow that with a one-liner. Again, I will actually give you the guidance that I give to my scribes as a printed paper, and I will include it here in the resources. We want to let them know that our review of systems is all completed for them. And if anything is positive that's not already positive in there, that they can just flip that to positive. They do not need to include any new things. They don't need to include the patient reports that their toe had been stubbed last week in the ROS. None of that stuff is necessary. We're just going for pertinent positives and pertinent negatives, which are already included there. In the physical exam, they are just going for, again, the pertinent positives, and they can just use our standardized dot phrases. We are giving them the pertinent positive as we are in the room with them, and that should be extremely simple for them. It's very quick and it's standardized. In our MDM, we are just verbalizing that to them in a matter of dot phrases. So, for example, I will verbalize to my scribe my current dot phrase, and I'll show you as I type it how they can type it as well, and it becomes very simple. So as I verbalize to my scribe, I will, for example, tell them the following. I'll say top line is .vs. Our next line is .well. The line after that is going to be patient with chest pain times 4 days. I'll tell them after that, please put .labs, please put uppercase EKG, please put CXR, please put troponin, and please put DCC because I know that it will pull up DC cardiology. And when I tell them that, this is going to reduce their spelling errors. It's going to reduce their confusion, and will help them get that note done a lot faster for you. So again, creating a standardized system. I start with telling them we're going to do HPI, ROS, and physical exam. As soon as we've seen the patient, those are complete, and we'll go back in the note one time to finish that MDM and any other thing we may need to finish, such as an EKG. All right. Again, if there are any words that we feel that they may misspell, we would create dot phrases to help them with those. So again, jumping into your scribe's note to fix errors is a slow process and requires more mental energy. This is the same with fixing resident notes. We've all been through this. jumping into any editing process is a time consuming process. We want to get things done right the first time. So set expectations before the note is written so that you're not having to fix mistakes. If there are long words like leukocytosis or hyponatremia, please make sure to include those as dot phrases for them, and I can show you here that they are included. For example, if we were writing a note and our patient here came in, they were looking well, everything else was fine, but we did note that they are here with weakness, and on labs that they have hyponatremia. Well, we would tell them, instead of saying hyponatremia, which can be very complex for them, and these scribes are not educated in medical terminology right away, we would say dot low or dot labs high or low NA, dot labs low NA. And that's something that's very simple for them. If we want to tell them that there's no leukocytosis, we might say non-specific leukocytosis. We can just say .nl. And when we talk like that to scribes, when we give them the systems to succeed, they will be able to get through a note much quicker. They will have less cognitive overload, and they won't have to type as much. So they'll be able to focus better on their notes. And additionally, it'll prevent you from having to fix mistakes. So, in terms of providing written documentations for scribes, or written direction for scribes, this is exactly what I tell my scribes. We've gone through it. Please use my .hpi dot phrase. Afterwards, place 1 to 2 sentences of visit relevant patient information. Use my ROS comprehensive. Only report positive findings. I say please only put the positive finding if it is already in the ROS and marked as negative. No reason to add new positives. Use my PE comprehensive. That's my physical exam. These will be completed in the room. And the MDM we will complete. We will guide them through it, and we will get it done very efficiently. These are our instructions for these instructions for the scribes can be downloaded in the resources section. And so here is what we've covered in lesson 4. We've covered setting expectations and directions for scribes. Remembering, scribes are typists. They are not medical experts. They are not residents. They do not have a medical education primarily, which is not usually the case at least. And they need guidance. We are inundating them with complex words and trying to have them thought organized for us. And that is ineffective oftentimes, leaves us frustrated with them and going back into the note to fix things, and leaves us frustrated with our overall experience in general. Again, we have to understand the importance of systemization, the importance of simplification, and creating those dot phrases for them, creating systems for them, and even teaching them how to use underscores and asterisks so that they can quickly move through a note, and also showing them keyboard shortcuts. We have to arm them with the information to succeed. Again, providing written directions for them is critical, and I hope this lesson was helpful. Here are some action items that we can utilize to enhance our note writing speed and our scribes' note writing speed. So one for us is staying ahead of patients during patient boluses. These are an opportunity to exercise your newfound speed and standardization processes. 3 patients, 3 notes, that's generally what we're aiming for. But if we have the capacity to see 4 patients and still remember and write their notes, we can go ahead, but we want to make sure that time is not crawling past us, and now we're letting that build to 5, 6, 7, or 8 patients that we do not have notes completed for. Again, an action item to highly focus on is standardizing your dictation process. That is, if you're dictating. If not, then it's better to use dot phrases. We've also covered using block text or Evernote for EMRs without dot phrases or dictation. And we've additionally covered how those can have some errors with them in terms of Evernote. Block texts will be for EMRs that do not have any sort of dot phrase capabilities. The next is giving scribes clear directions, and we've just discussed this in lesson 4. They are typists, not clinicians. Lastly, please address any special circumstances that would limit you from becoming more efficient. If you need to comment or send me an email, I am happy to respond to whatever challenge that you feel may not have been covered adequately. So, we will go through a course recap on our next section.